So Sarah, as you know, I'm doing the marathon, and I guess I've never done anything of this magnitude before. I can run, happily do a 10k. I haven't got any health problems. I have regular checks, standard blood tests and things like that. What is going to make me fitter and faster? What do I need to be looking at? Because you're the expert in sports and exercise medicine, so give me the lowdown.
Well, if you take off your GP hat and put yourself in a patient role, you have to ask yourself, what do you want to achieve? How do you want to achieve the goals that you set in your endurance task? I mean, I think you're relatively fit, you've done 100k cycles, you've done different sporting events, but you actually have to think, how often do you think about how your body functions?
Never.
Okay. And when was your last medical?
I had a blood test probably a year ago, maybe, but literally just a blood test.
Okay, so starting with that initially, we have to look at, do you have any discrepancies in your muscles? Do you have any pain anywhere? Do you have any mechanical faults? So things that mean that you don't line up properly. Whatever your sporting hobby is, we need to make sure that you are mechanically going to be running in line. You're not going to be putting damage on your knees or on your ankles. So number one is looking at you clinically. The second thing is you do your own blood tests because you want to know you're fit and healthy, there aren't any things that you need to change your diet for, you don't need to take any supplements for any particular things. These are fundamental for endurance events. And as a doctor, you know, iron levels are really important for your oxygen supply, vitamin D is really important for your muscles. There are various other tests that we can do to actually see what do we need to optimise to carry you through this 3 to 5 hour endurance event.
When you say it like that, it's a long time, isn't it? So yeah, I'm not an endurance athlete. Okay, I'm doing an endurance event, but you know, I'm not a high-end elite athlete. Because I suppose most of these things are geared, you know, in my mind, you look at that and you think, well, that's not for me, but actually it is for me. These are the things I need to know, clearly.
I think it's for all of us, actually. It's not just for somebody doing a really long sporting event. I think it's fundamental for all of us to make sure we're not fatigued, we don't injure ourselves, and we're actually performing to our best. And this doesn't just apply for sports. This applies for everyday function. If you're someone who works 12 to 16 hours a day, and you're constantly exhausted, are we looking to see what's deficient in your diet? Are we looking to see what's keeping you alert, what's helping you prevent illness? And these are the elements in our nutrition screens that you and I do that we're looking to ascertain. How can we improve the lifestyles of our patients, but also for sporting events, how can we improve your performance, stop you getting injured, stop your muscles hurting? And that's just one element of what we're doing.
So the other thing, I guess, is looking at, you know, part of when I signed up to the marathon, I thought, well, that's great, because actually by, you know, a month before the summer starts, at least I won't be thinking of having to lose half a stone to get summer ready. So, you know, body mass, body fat, my muscle mass, my bone density, of course, is something else that I need to be looking at. And I would be really intrigued, actually, to monitor and see what changes, rather than just going, oh, you know, I'm a bit looser on my trousers.
So I guess there are different elements with that as well. We've got our body scanner that we utilise for that reason. Most people want to know where they store their fat. Equally, it's also important to know, are our muscle groups in the particular parts of the body that we're using for an event, are they developed enough to enable you to prevent injury, to have the right power, to sort of carry you through a long event, whether or not it's weightlifting, whether or not it's running, whether or not it's cycling. So you're right, it's great to do a pre, and it's great to do a post body scan, but also it's good to look at your bone health. So our ultramarathon runners, women who are deficient in iron particularly, and also other athletes who are vitamin deficient in vitamin D and calcium, their bones aren't as strong. So if we ascertain your bones are thin, your muscles aren't as well developed, we know how we can improve that. So we can make very simple adjustments to diet, to vitamins, and also to training to ensure we're protecting joints and we're building up muscle around the joints that you're going to actually putting the most force through.
So we're going beyond the scope of just getting on the trainers and running. We're actually being strategic and getting you to run faster. Don't be expecting amazing things, but you know, finish in a good time and finish in a good state as well. Because that's what worries me. I don't want to be looking back 5 years' time thinking, oh, I wish I hadn't done that.
We know we've got access to all the lead consultants, but no, that's not what we want to do. We want you functioning, we want you as a well-oiled machine, we want you recovering well, and we want to be able to sort of hone in on your diets to make sure you have that energy to carry you through the event.
So we would look at blood tests, general blood tests, because I need to do those anyway, specific blood tests to ensure that I'm match fit for the event,
Exactly.
and then monitoring by means of my body scanning, my body fat, my muscle mass, and my bone density.
And your simple mechanics, how you walk, how you run, and how we can actually sort of change those muscle groups to make sure you don't injure yourself.
So we can link in with physio, because they're well placed to do gait analysis and check everything that needs to be optimally functioning for me to do this. Now I'm getting worried. That's good. So essentially, I need to get on, do these tests, and get a training.
Let's get started.